Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, April 5th, 2022, and as always, this is your chance to get your COVID questions answered. I'm joined today by CPS CEO, Chicago Public Schools, Pedro Martinez. Thank you for being here again.
Thank you.
And we know both of us continue to get a lot of questions about COVID, what's happening in the schools, and so we will have plenty of time to take your questions. You can use the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. As always, we'll start with a look at our data dashboard. I'll run through some data slides, and then you brought some slides as well with how we're doing in CPS. A little bit more background, just because this is the main sort of public-facing thing we're doing at this point. And then we'll go to your questions. So, chi.gov/COVID-, as always. If you look, you see that we are continuing to see this rise, but nothing alarming at this point. Very consistent with what we're seeing in the Northeast, and I'll show you that in a minute. So we're averaging about 284 cases per day, which is up from 214 a week ago. You can see in the graph there, and just as a reminder, you're welcome to blow any of these up. You can play with it yourself if you want to look and see. We remain, this really looks pretty similar to what we were seeing last July in terms of that kind of an increase, as opposed to what we saw in January with this huge Omicron surge. So, with each passing day, as the BA2 variant becomes more predominant, we'll talk about that. I do think, we are seeing an increase, but I'm thinking it's going to be probably more like what we saw, during Alpha and during Delta, as opposed to this really out of control that we saw during Omicron. I also wanted to highlight that our hospitalizations are looking very good. 8 Chicagoans per day being hospitalized across the whole city. That's down from 11 last week. And you can see, again, if you blow this up, this is just about the lowest we've ever been, again, comparable to where we were last summer. So that is good. And our deaths are actually averaging much less than 1 Chicagoan per day. And that is the lowest we have ever been. If you look, we never got down to that point even last summer. So these vaccines are wonderful and doing a great job of helping to keep people out of the hospital, keeping people from dying. But it is important that people stay up to date. That means getting a booster. And then, as we discussed last week, for those over 50, those with immunocompromised conditions can also consider getting the second booster. But the most important thing is getting that first and second dose as well as the booster. Positivity also just ticking up 1.6%, up from 1.2% a week ago. But again, not unexpected and nothing that I have a huge amount of concern. Again, looking very similar to what we saw, if you compare here, last summer. We got some questions in about who is getting vaccinated now. So you can see we're averaging about 2,400 vaccinations a day, and we continue to tick up. We're at 77.4% of all ages, including the little ones, have had at least that first dose. But just as a reminder, if you click on vaccines here, this is where you can dive in and look by age, gender, race, ethnicity. So if we look at race, ethnicity, just as one example, you can see what the percentages are. 62% approximately of Black non-Latinx Chicagoans have had that first dose, as compared to about 76% of Latinx Chicagoans. Just a little lower there on white Chicagoans, and then most likely to be vaccinated are Asian Chicagoans at 85%. But you can also click here if you want to see like daily average doses, for example, and let's just look over the last month or two. And this, because I left it on race ethnicity here, you can see that actually for about the last month, in purple here, every single day we've been seeing, and at least one dose means people getting their first dose of vaccine. We have been seeing, for the first time in the whole pandemic, Black Chicagoans most likely to be getting their first dose of vaccine, which is good because it's where we have the most room to grow. So you can follow that, and then this is for completing the vaccination series, getting that second dose. And I just wanted to highlight that we started calling here about a week ago. We started calling about 40,000 Chicagoans who we had records of getting a first dose but not a second dose. We calling people who were older and we didn't have records of getting a booster, and we're seeing some of that tick up, which is good to see. So making progress every day, and right now, while COVID remains in reasonably good control, is the perfect time to get up to date if you haven't. All right, so let me just show a few slides about where we are nationally. And then we'll turn it over to you. So it is National Public Health Week, if you did not know, April 4 to 10. Just highlighting public health is where you are. It's all about where we live, how we make communities healthier, stronger, and safer. And if you follow us on social every day, we're putting out how CDPH is celebrating National Public Health Week. But thank you to all the public health workers here in Chicago and across the country. So if we look across the world, and those of you who have been following closely know that while we are doing quite well in the U.S., darker means higher number of cases per population. There are parts of Europe, parts of Asia, Australia, New Zealand that are seeing very, very high case rates. So just to give you a sense, that dark purple is more than 70, per 100,000 per day. Remember, we're at about 7 or 8 here. So they're literally seeing COVID case rates 10 times what we are. And a lot of this is being driven by BA2. However, we are, for the most part, not seeing a lot of hospitalizations. And mostly, UK is seeing some increase, but most of these countries, even where they're seeing surges, they're very vaccinated, better than we are in Chicago. And in that setting of being highly vaccinated, even with for some of these countries, record-breaking number of cases, the hospital admissions have remained relatively low, which is reassuring. But just for me, another, to be prepared for the future, make sure we're as vaccinated as we can be. I also wanted to just put the U.S. in some context here, and I know this can be, there's a lot on this slide, but this is you could, if you want to Google, this is just our world in data, and you can explore it. But the U.S. is here. It's this. Do you see where it says Canada, U.S., India? This is what our current cases are. You can see that Germany, Italy, UK having dramatically higher cases and had these huge surges, much greater than what the US had even during Omicron. And test positivity is also really high. I'm thrilled with our positivity. It's less than 5%. You can see we're, again, way down here in blue. And some of these countries, not only are they having high case numbers, they're having positivities. The orange and the brown here are 20%, 30%. There are some 40, 50%. So huge COVID surges, but in a highly vaccinated population. So the U.S. looks good overall. If you take a look, this is average cases per 100,000 per day. We're at 8 right now. So that's I'm very happy with that. Anything, even the WHO, anything under 10 is considered, very, very good control. And across the U.S., we are seeing some slight increases, just like what we're seeing in Chicago. So if you look, these are the states right now that are actually seeing the highest COVID rate. So the U.S. overall in the upper left there continues to be flat, continues to be down. In the Northeast, where BA2 is more predominant, you can see, Vermont, New York, Massachusetts, New Jersey, all ticking up just a bit, looking very, very similar to what we're seeing in Chicago. So not alarming, certainly something we'll keep watching, but each passing day, I feel more confident that we'll be able to evade a very large surge right now. And again, just for some comparison, that's what's happening in New York City, and that's what's happening in Chicago. As a reminder, the CDC has these community levels that we have been lifting up, and really pleased to have a national risk assessment, which I think, frankly, we needed. And here in Chicago, we did a travel advisory to help advise around this, but the CDC now has set just a simple low, medium, or high risk by county. Chicago remains low, and in fact, almost all of Illinois remains low. There is one county, Edgar County, that is in that yellow range right now, having just a little bit of an increase. So if you were to go to Edgar County, we would recommend, for example, wearing a mask, being more careful. And then there's just a very, very few localized outbreaks that are high risk right now. If you were to go to one of those, that's where, we recommend not going if you're not vaccinated. We recommend definitely wearing the mask indoors. But the country overall continuing to do well. Just 5% of counties are at medium or high risk, and we're doing beautifully. This is what variants look like. Omicron Omicron BA.2, that subvariant, is just over half of what we're seeing. We hit that at the end of last week. So right on track. We thought we would hit this right around the end of March, and that's exactly when we hit it. And you can see that really each week we've been seeing BA.2 doubling, more or less, every 7 days or so. And I see no reason that that will not continue. BA.2 is more contagious, more infectious, and it will probably outcompete B1, which is the original one. What's good news here is that if you look in the Northeast, you see how these pie shapes are 3/4 the light pink and then 1/4 the dark purple. The light pink is BA.2. So in those parts of the country, you can see here in Chicago, we're about 50-50. In the parts of the country that are already 3/4 BA.2, they're not seeing huge surges either. So I'm feeling pretty reassured, although of course we're keeping an eye on it, and I do expect numbers to continue to go up in terms of cases. This is what our map looks like in terms of vaccination coverage, making progress every day. And I just want to remind you that we do see more breakthrough infections, and especially during the Omicron surge, we saw that happen, but that is not a reason not to get vaccinated. And this is something that I continue to just have conversations with about people every day. These vaccines are working very well against severe illness, hospitalization, and death. They are not 100%. There's no such thing as 100% vaccine. But I just wanted you to know that right here in Chicago, 99.77% of fully vaccinated Chicagoans have not subsequently been hospitalized for COVID-19. And this is our EPIs behind the scenes looking at everybody who gets hospitalized and comparing it against the vaccination record. So this is not, did they tell us? This is really our best analysis. It's a lot of work to follow this, but we think it's important. And then similarly, 99.97% of fully vaccinated Chicagoans have not subsequently died from COVID-19. These vaccines are safe. They are very effective, especially against severe illness. At home is going well. We are offering both first and second booster doses for free at home if you would like it. We're currently offering appointments Saturday through Tuesday, 8 a.m. to 6:30 p.m. Anyone over the age of 5, you can get Pfizer pediatric, adult, or booster vaccines. And in our least vaccinated zip codes, which you can see on the right there, and we've got online if you want to see the map, there are still $50 gift cards for people getting their primary vaccine, their first or second dose, if they're getting it through the city, through CPS, et cetera. I mentioned we've been doing this outbound calling and getting vaccine appointments scheduled. So if you get a call from the call center, they may be calling to make sure you're up to date. And we've been prioritizing lower vaccinated zip codes, and we've seen an increase in vaccinations in at home and sort of since we've started doing this. So that's been good to see. As a reminder, first booster doses are recommended for anyone over the age of 12. You should get that first booster 5 months after getting either Pfizer or Moderna, or 2 months if you got J&J. And then the second booster dose is eligible 4 months after that first one for anybody over the age of 50 or anybody over 12 who's moderately or severely immunocompromised, or anybody who got J&J. But basically, the strongest thing is to get this one, please. We clearly saw that people who were vaccinated and boosted had a much lower rate of hospitalization and death during the Omicron surge. That was true in Chicago. That was true across the country. Somebody who was vaccinated and boosted, 21 times less likely to die than somebody not vaccinated. So getting this booster, this third dose, is more important, and making sure everybody in your network has had all of those boosters. And then for people who are higher risk, yes, you can get the second booster. I'm going to keep reminding you every time, nothing has changed for isolation or quarantine. Regardless of your vaccination status, if you catch COVID-19, breakthrough infection, or you've never been vaccinated, it doesn't matter. You need to stay home for 5 days. That's really important for helping to stop that spread. If you're feeling better by day 5, we see a lot in people who do get a breakthrough. If they're fully vaccinated, a lot of people get pretty mild symptoms. If you're better by day 5, you can leave your house, but you have to continue to mask if you do for days 6 through 10, because there still is some possibility of potentially spreading there. And that is true in schools, that is true in workplaces, that is true everywhere. And that is not going to change anytime in the near future. Just a reminder, we'd like everybody in Chicago to order your free at-home COVID-19 test from the federal government. Go to covidtest.gov. There's a second set now available, and they're coming really fast. So I'd like everybody to do this right now, again, so we're more prepared in case there's a surge in the future. We talked a lot about this, so I won't highlight it, but there are early treatments available, more every day. If you test positive, especially if you're older or have an underlying condition, there are IV and oral medications available that can help keep you out of the hospital. They're available whether or not you're vaccinated, but you got to take them early. So you can't wait a week or two and then want to get them. So please reach out to your health provider. And we've got information on the website for how to do that if you don't have a health provider. And then finally, there has been a lot. I was pleased to see at the federal level, there's been some progress in terms of passing some additional federal funding for COVID. But regardless, there are things changing around provider reimbursements. I just want to be really clear that in Chicago, no resident, regardless of immigration status, insurance status, et cetera, should ever be turned away from receiving or be asked to pay for a COVID-19 vaccine. That is true at our clinics. It is also true at any other setting. And so we want to hear about it if that happens to you so that we can address it. We will always make sure that COVID-19 vaccine is available free of charge for anybody in this city. So chi.gov/COVIDvax or 312-746-4835. And then it's our last town hall tonight. CEO Martinez and I have been at, I think, 5 of these, and this is our 6th, all over the city. They've been really interesting, and it is the last one happening tonight. This is the one focused on the north and northwest side, so you don't have to live on the north and northwest side to come, but if you're interested, this is an opportunity to really talk to folks in Chicago, talk to commissioners. The mayor is there, the CPD superintendent is there, the CEO, et cetera, and we'd love to see you out tonight. I've really enjoyed the conversations and the ideas that we've gotten at these town halls. And lots of questions we've been getting about mental health again. So I'm not going to go into details, but people have been wondering, what are you doing around mental health? I'm going to be bringing one of our folks who's been working a lot on the new mental health investments onto Facebook in the next week or two. But I did just want to highlight that under this administration, we have 7 times the amount of funding that we had for mental health. And we're funding now 38 clinics in 35 community areas. And we have a plan to actually expand to funding those clinics to all 77 community areas this year. And that is, there are some clinics that CDPH operates directly. Some of this is funding additional personnel and access to mental health professionals in healthcare settings, but also food pantries, et cetera. We also are funding teams of mental health professionals to respond to 911 calls for the first time. It's a pilot, but we're excited about that. That's called the CARE program. We're launching programs to divert Chicagoans that have serious mental illness or addiction away from the criminal justice system. That's been a big focus with CPD. And then, of course, investing in both our mental health clinics and citywide coordination. So mentalhealth.chicago.gov if you want to read some more about that. But we are going to talk some more about it on here in the next couple of weeks. And then I'm just finishing with some pictures here. It's been really nice. On Sunday, I was out at the Garfield Park Conservatory for our youth-focused Face Forward for some of those vaccine ambassadors, which was nice. And there are these Vax Chai art exhibits at parks all over the city. So thanks to the artists, thanks to the Design Museum of Chicago, thanks to all the partners that have been part of this, seeing some murals that they're not all directly about vaccination, but they're about sort of positive coming together, and they've been part of really trying to have very positive messaging around vaccine. These are just some of the new murals that are going up. Isn't that nice? Yeah. And so keep an eye out for some street pole banners. These, again, are Chicago artists that have developed a lot of Chicago-specific images, and we are continuing to use these, and I'm really happy with the progress that we're continuing to see. So I'm going to that was a lot, but I'm going to hand it over to you now, and to go through some of the CPS data, and then we will take your questions.
Thank you, Dr. I don't have too many slides, but I want to give our community just an update on some of our school-specific data. So you can see our cases. So it always is a pattern. So whenever there's a slight increase in the city cases, it eventually follows into CPS. It's always been that pattern. So our cases are a little bit up. You can see we have 295 students with positive COVID cases. We had 119 staff. That was for last week. And then We are seeing more children that are in quarantine, 789 and 150 staff. Keep in mind, we were quarantined over 30,000 students during the surge of Omicron. So even right now, these numbers are still low. But again, as cases are rising in the city, we see more cases in CPS. We get a lot of questions about our safety procedures. So even though we are mask optional, we're always encouraging masking in every school. And I'm in schools every week, and I see the vast majority of our students wearing masks. Anytime we have cases, we do require masks in those classrooms. And so that is happening even as we speak. Let's see. And this is just showing where we're at in terms of we still are doing robust testing every single week. We have over 90,000 students that are registered. We did clean up the data because we do have during the year students that transfer. And so if anybody, as they're tracking data, you see slight changes, we are cleaning up that data, especially as we're going into spring break. But you can see, again, still very high numbers.
It's a lot of people.
A lot of people. And this is, look at the number of cumulative tests that we've done. And keep in mind, when you look at the testing that Dr. Awadi shows for the whole entire city, our testing is included. And we represent a big percentage of the testing that's happening every week. And you can see the positivity rate is specifically for last week. So we went as low as 0.08%. That was our lowest.
It's unbelievably low. I think that's got to be the lowest, certainly of any of the large school districts across the country that we've been looking at.
It's the lowest since we've ever tracked it.
Yeah.
We did tick up, but even now we're still at 0.2%. So that is not an error, it's 0.2% as of last week. So again, we're seeing a slight uptick, but still very, very gradual. And then you can see our vaccination rates, and I'll talk a little bit also about first shot. So the great thing is we are actually exceeding the national averages. So over 51% of our students in district managed schools are now fully vaccinated, 63% 12 and up, almost 40% of 5 to 11. And what's exciting is that for first shots, our 5 to 11 are now over 45%, almost 46%. And we're seeing our 12 to 11 first shots is well over 65%. So again, slowly creeping up on the 12 and up, but on the 5 to 11, I remember when we were in the low 20s, but I was seeing first shots in the 30s, and there's always a lag because it's 3 weeks between shots. But I'm really happy now that we're seeing fully vaccinated now close to 40%, and with first shots now we're going to be over 40, almost 46%.
Yeah, first shots getting near 50% is really exciting for that group. That's way above national average, and for both the little ones and those teens. So it's great.
Having our district 50% overall fully vaccinated also for us is a nice game changer.
Yep.
During spring break, community, we are in families. We're not going to be doing any testing. Our schools will be closed, but you can go to our website. You can see the address there, and you can see information on meal distribution. We work very closely with Dr. Awadi and her team around just giving you updated procedures for travel, testing resources that are still in the community, vaccine resources. Again, we just continue, and once we're back in school, we're going to continue to have more and more vaccine events. But like I said, I'm really very, very optimistic now as I see our vaccination rates, our low positivity rate. And so again, everybody, please thank you and continue to have your children get vaccinated.
All right. Excellent. It's so nice when we can share relatively good news,
Yes.
All right, so we're going to turn to your questions. I'm just switching over here so I can see the feed. Maybe just to start off a little bit, all right, lots of different kinds of questions here. So we'll start off with one for you here. Jason Guthars on Twitter is asking, will CPS or Dr. Arwady, et cetera, reinstate mask mandates for Chicago public schools or indoor spaces to protect Chicago, or wait until hospitals start filling up again? So if you want to start with that, and then I'm happy to sort of chime in too.
Yeah, so what's great now, and this didn't exist especially at the beginning of COVID, even last year, is we now have a national metric that goes county by county. So right now we are in low, so that's your first indicator. If that switches from low to medium, and then of course if that happens, we're going to be immediately in discussions with Dr. Awadi and her team, and if she's seeing also, the data also switching locally, because Dr. Awadi, you've always had your metrics also for the risk levels. So what I see is now there's alignment. So if we see risk levels rise both from the CDC as they look at our county, as well as the metrics Dr. Awadi follows, we will definitely reinstate mask mandates again. Now, again, I'm going to say this as I said before. Where there's cases in individual classrooms, we are already enforcing mask mandates in those specific classrooms. That has never changed. Children that are positive with COVID, they have to quarantine for 5 days. They come back, those second 5 days, they have to wear masks. And so those have never changed, even with us being mask optional.
Yeah, great. And I would just add to that, we are in a different place with COVID than we were a year and a half ago, particularly before we have vaccines. And for me, this is where watching what's happening in Europe and Asia is actually very instructive, because we're seeing very high case rates. I mean, higher than we were during Omicron, and positivities higher than we ever saw. But because this is happening in a highly vaccinated setting, we are not seeing that turn into severe illness. We're really seeing this much more mild illness, and I know, and certainly we have folks write in, they're immunocompromised. This is a challenge always if we're seeing a surge. But please know that we are on the conservative side here in terms of being careful around COVID. The CDC has said at high risk, that orange level, that they recommend indoor masking. I would anticipate, we wouldn't just recommend, we would be requiring an indoor masking at orange. And I think, frankly, in that, if we got to yellow, I would imagine that CPS would also require it, for example. Not to sort of put words in your mouth, and we're going to see where we go.
We've always been more conservative.
Yeah, and the idea is, as a public health department, as a city, we've got to keep our focus on making sure that we're monitoring really well what is happening.
That's right.
So that's where having, this testing of, 0.2, it's less than a 1% positivity. I love that. It is where we would expect it to be with what we're seeing at the city.
With more testing than ever.
More testing, exactly.
We're doing an average of 60,000 tests per week.
Yeah, exactly. And so that is also part of what is having our positivity as a city look lower. But regardless, that is really, that's testing people who don't have symptoms, right? That's testing.
Testing.
And so it is this very large cohort of people from all over the city that give us a sense, we have lots of ways that we follow this, but really this cohort is one of the ways that we follow. And if we start to see signs of concern, there's the population level, but more to the point, we have not dropped our work as a city, and CPS has not dropped its work as a school district where we see problems, where there is an outbreak, where there is a cluster. Investigate, get in, do the case investigation, put mask requirements in, potentially do genomic sequencing, depending what the situation is. And I sometimes say the masks, they're kind of like an umbrella. Right now, you don't have to carry it all the time, but it's spring. And so it can rain from time to time. I keep my umbrella in my bag, just like I keep my mask in my bag. And there may be times or situations where either you decide to put it on or you're in a higher risk and outbreak situation. But if we get into monsoon season, of course, we would require it again.
That's right.
So,
That's right.
All right. Mindful Monkeys on Twitter says, what are you going to do about the wave being fueled by North Side schools?
So what's interesting? We are seeing at a couple schools more cases. What's interesting is that those schools are very highly vaccinated. We do have safety committees there in place at those schools, and so they always meet and they get to decide, what further actions they need to take. So far, we just been quarantining the actual children that either been exposed or been positive. They're masking in those classrooms as well. And the contact tracing we're seeing right now, working with CDPH, it's been always, the origin has been outside of the classrooms, events, things that are happening. I love the fact the weather's getting warmer, people are getting together, so we're seeing slightly cases, but again, nothing that is alarming us. And especially, like I said, these schools tend to be they tend to have a higher vaccination rate.
Yeah, and it's interesting. The evidence continues to be very good that having BA1, the original one, looks to be very protective against BA2. And so we saw our west and south sides get hit especially hard during the Omicron surge, especially the south side. A lot of that by some differing vaccination rates. But we do think that there is at least some pretty good short-term protection there in terms of what's coming next. So not just here in Chicago, but in cities across the country, actually they are seeing more with BA2 actually tends to be in some of the more, some of the wealthier parts of the country are actually seeing a little more BA2 in places that got hit really hard by BA1. So we're continuing to follow it, but you are right that where we are seeing some more cases is in those areas. Some of that is a factor of testing. A lot of it is, I think, just there is a lot more socializing, and that's fine. We are in a good place to socialize when folks are vaccinated, but we probably will see some more breakthrough cases. But even in those parts of the city, we're not seeing it turn into a major problem or a wave, as you say. It's more individual situations
and
at this point.
You're not seeing hospitalizations.
No, that's right. Miriam on Twitter, will Chi Public Schools consider expanding hours for on-site vaccine clinics? Can they work with community organizations on site and not just IDPH vaccine clinics? I have a thought on that, but if you want to.
No, absolutely. So we're still having mobile events every single day, and I will explore with the team about expanded hours. We are seeing very little individuals coming to the vaccine clinics, and so the challenge has been, and we've had multiple community conversations, we still continue to see just a hesitation on many of our communities. So it hasn't been, the accessibility has not been the question, but with that, we're more than happy to collaborate with any community agency. Community agencies for me are the best because they tend to have credibility in the community. They've been around in those neighborhoods, so they actually see better success, sometimes in getting more people to come for vaccines. So again, we're more than happy to partner with community organizations.
Yeah, and I would just add to that, we survey people who are vaccinated, are not vaccinated. We sort of follow this. There's national surveys, there's local surveys, and it's 1%, if that, of people, if they're not vaccinated, say that it's because of an access issue at this point. And we've been working with CPS to make sure that, that our at-home program is open to anybody in CPS.
Right.
That is open weekends, evenings,
all ages,
always, all ages, and we would love to bring vaccine free of charge, to any CPS family's home. And if we can do the child, and even better, an adult, a grandparent, do a booster for grandma while we do it for, we love that. Yeah. So we really, when numbers are low, it's not really an access issue so much. They're widely available also at pharmacies and doctors' offices. It's more that conversation around, building confidence, seeing the data, and that's been, I think, in some ways, the even more important role that CPS sort of has been playing in terms of that conversation, how to bring it. So I love the way that you're thinking about that, but I do think it's more around making the decision to get vaccinated as opposed to a whole lot in that barrier space right now. All right, we've got a couple, this one's for me, on Kristen Korkowski on Facebook and Alexandria Deanne on Facebook. Kristen's asking, what about this new variant in Europe? Alexandria is asking, what's the deal with this XE variant? I know it's not yet a variant of interest. Oh, you've been paying attention, I love that, or anything like that. But with it spreading in the UK, with BA2 now being dominant here, I'm curious how you're feeling about this. Is it going to be a constant cycle of new variants, or is this a potential concern? Yeah, so let's just talk about quickly variants again. So remember that SARS-CoV-2, the virus that causes COVID-19, continues to mutate all the time. It has since the beginning. And as Alexandria said, almost every day we're seeing variants of some kind. Usually they don't matter at all. They don't have any difference, but this is why, even here in Chicago, we've built up the ability to do that genetic fingerprinting of not the individuals, but of the virus from all over the city. So we have a good eye on this. And most of the time they don't matter. But if you start to see multiple cases or something, first, we label it a variant of interest, just like Alexandria said. Variant of interest means we're interested in this. We're watching it. There might be something worrisome. Next is variant of concern. If you hear variant of concern, we're concerned, and you should be a little bit concerned too. Omicron was a variant of concern. Delta was a variant of concern. All these little subs, no. And then there is a next level called variant of high consequence. We have never had a variant of high consequence. A variant of high consequence would be a variant where the vaccines are not protecting people, especially against severe illness, or there's been some change that makes it much more dangerous, or something that really, really changes our ability to respond to COVID. So happily, we haven't seen one of those. And if we were to see one of those, it would necessitate probably a really different approach. But in the absence of that, just like Alexandria said, it's not even a variant of interest at this point. But what is, quote, XE, or what is this new variant? So it is still Omicron. Omicron has lots of sublineages. B1.1 was the big one. BA.2 is the other one. And this, quote, XE is sort of a mix or a recombination of the two big Omicron subvariant. So it's a mix of BA1 and BA2. Mostly it's been detected in the UK, several hundred cases, but nothing at this point that is clearly showing major concern or spread. And so it hasn't even been labeled at this point an official variant of interest. We have had some cases of it detected in the US. We have had some cases of it detected in other countries. To my knowledge, at least as of yesterday, we'd not had one in Chicago or in the UK. Chicago or Illinois. It is a little, it may, whenever you see a new variant emerge, the main thing is it may have some little advantage. It may be a little more contagious. But no, this is not one at this point that I have any specific concern about. It remains sort of a version of Omicron. When you hear, a new variant, like that is actually going to get a name, like a variant of concern, that would be named Tau, or, it would be named sort of the next big letters. And at the moment, are we going to continue to see variants? Yes, but we will let you know if it is a variant of concern, and we would act also, to be clear, in the setting of a variant of concern. All right. Just a note here, Amanda Bernas-Dowd on Facebook is just commenting. She'd love to see this scheduled at a time when teachers or students would be more available to participate. I think it's always a challenge between wanting to make sure we can have this accessible. I know there's things that happen at other times too. I don't know if you want to mention anything just to Amanda's comment. It's a good comment.
No, absolutely. And so, we've had in the past even special sessions for parents, and even staff with Dr. Awadi. And maybe Dr. Awadi, maybe even before the end of the school year, that might be something we can schedule, because those have been very, very popular, especially as we start planning for the summer. So I'm going to take that thought with us to think about scheduling some events, and we usually do them in the evenings. So again, and of course, we're always going to update our data, and we're always going to continue to partner around information sessions at our schools as well.
All right, so we've got a bunch of booster questions, so I'm gonna hit on those a little bit. So Anthony on Twitter says, there seems to be some conflicting information about when to get another booster. Should we wait 6 months from the last one? Should we get it sooner? And what if you had been positive for COVID? All right, good question. So let me kind of talk you through the whole thing. And I'm going to answer Diane Ponder's question here too first. Diane Ponder on Facebook says, does fully vaccinated mean including one booster? Fully vaccinated, as it's been used, means you had your first and second doses, or your one dose of J&J. But up to date, this is the terminology that's been used, means that you've gotten all of the primary series and you've gotten one booster. There is no requirement to get a second booster even to be considered up to date, because it's only been, a recommendation for a certain group, and even that is probably people who are higher risk. So you're considered fully vaccinated, and pretty much all the mandates have been around just getting that initial series. That's the most important thing in terms of protection. Up to date is having had at least that first booster at this point. Might in the future there be, another a change to that? There could be, but that's just defining that. So back to Anthony's question. When you've had let's just assume you got a first and a second dose. You're eligible for your first booster 5 months after finishing your either Pfizer or Moderna, okay? So you are right that it was sort of 6 months at the beginning, but as we've learned more about how long that protection lasts at a really high level, especially for breakthrough infections, that dropped back to 5 months recommendation for the first booster. If you got J&J for your first dose, the recommendation is actually just at 2 months. You really need a booster if you got J&J. So that's the most important thing, getting that first booster. The second booster conversation that we're having, let me just give a little bit of background again on that, because I know it can be a little confusing. That one is available for people who are over 50, regardless of whether they have underlying conditions, or anybody over 12 who has moderate to severe immunocompromise. And I saw some questions here. Somebody was asking, are they available now? They are available now. So you can get a second booster at a pharmacy. You don't need a special second booster appointment. You can walk in or make the appointment and get one. They're available at doctor's offices. They're available at CDPH vaccination clinics, our partner vaccination clinics. They're available through our at-home program. And so Anthony, if you got your if you're up to date, meaning you had your first booster and you're going to get your second booster, you should wait 4 months. Okay, so that is a little confusing. I agree with you, and this has been hard. But the reason that timing has changed is we've learned more about timing, and the reason that recommendation is only for people who are older or moderately or severely immunocompromised is that, to be honest with you, the additional benefit from that additional dose, each additional dose is giving you a little bit more benefit. There was data out of Israel, this is where this came from primarily, that showed that when you compared, hundreds of thousands of people who had had 3 doses of Pfizer versus 4 doses of Pfizer, people were slightly less likely to die if they had had 4 doses versus 3 doses. However, I want to be honest with you that people who go and get a 4th shot are probably a little bit different from people who don't, right? People who go and are more concerned about COVID may also be the people wearing masks a little more, may also be the people being a little more careful with COVID. And so different from what we'd seen with 1 and 2 and that third booster, which clearly, Omicron was a 3-dose variant, if you know what I mean. It really made a difference if you'd had that third dose. We don't have such strong data at this point that 4th dose is making a huge difference. It is making some difference. And there's not a downside, to be clear. There's not safety concerns related to this. It's not like if you get a 4th dose in some way, you can't get a booster if we're doing it later for everybody. And it's really around, to my mind, it's around if we were to see a major surge in the next few months, it's too late to start trying to kind of vaccinate everybody then. So for our most vulnerable people, and we know that older folks and those who are really immunocompromised are at highest risk, some additional protection there, makes sense. So if it's been 4 months since your booster and you're over 50, or you're over 12 in immunocompromising condition, or you got J&J, we recommend at least considering to get that 4th dose. But more important is that everybody in your network, everybody around you, has had 1, 2, and ideally 3. And if I could choose between, getting the folks who haven't had any done or getting the folks who haven't had a booster done, and magically sort of make that happen, but otherwise the vaccines are here and available. So I hope that helps. Valdastatin, the second booster dose, is available right now. Erica Allison asking, should those who had Omicron infections and are eligible for the second booster be getting it now, or should they wait longer? That's a really good question. I'm going to be honest, we do not have the full answer to that question. I would say personally that if you are fully up to date and you recently had a breakthrough infection with Omicron, your protection is really quite good against BA2. If you're high risk, like I said, I don't think there's a significant downside to it, but I would not as strongly feel like it was really necessary for you to get it. I think in the fall, I don't know for sure, but my guess is that in the fall, I'm hopeful. There's trials happening right now of some of the versions of vaccine that are more specific to some of the variants that we've seen, to some of the Omicron changes, the Delta changes, and depending what happens with COVID, I would not at all be surprised if, for example, this fall, there was a recommendation with a version of vaccine that had been tweaked a little bit to be more specific for the changes we've already seen. And could that be an annual like flu shots are? It could. I don't know yet. But remember, the booster you're getting right now, it does raise your antibody levels back up. No doubt about it. It gives you some more protection, but it's a little bit of diminishing return. So if you've just had Omicron, you're not much older, you don't have significant underlying concerns, I think you could wait, but you could also talk to your doctor if you want to make that decision. On Erica's question here, should they wait longer? We think that for at least that 3 or 4 months after getting vaccinated, your levels are high, they're good. That's part of where that dose came from. I think we may have a different booster ahead of a potential surge in the fall. But I think if you haven't had Omicron, especially, and you're over 50, underlying conditions, et cetera, it probably makes sense. If you have, your protection's pretty good, but if you decide, you can do it. I wouldn't be trying to time it with I'm going on vacation or I'm doing that. People ask that sometimes. But I want you to hear that if there is a big surge, it's too late to sort of try to be vaccinating a lot of people right then. It takes a couple of weeks for that protection to kick in. We see that when a lot of people want to get vaccinated, it's harder to get them, supply, et cetera. So that's why some extra protection for folks who are most vulnerable right now. That's why I think that recommendation was given. And then Jean Brooks, just to finish out the boosters for a second here. I am on Prednisone for asthma exacerbation. Can I get my booster, or should I wait until I finish the burst? And I'm 77. You can get your booster, even if you're on Prednisone. That should not interfere significantly. Obviously, you can ask your doctor, but you can go ahead and get the booster. And in fact, if you're on Prednisone, that can drop, as you know, your immune response a little bit. And if you're 77, that would be a recommendation. Obviously, talk to your doctor with specifics. Okay. Let's go back to some more CPS ones real quick. We've got a few more minutes here. So Lee Mabry White on Facebook says, since masks have been off in school, my child has missed 7 days of school. There's illness, they've been have to be picked up from school 3 times. It seems we don't have good air filtration. Will CPS continue to work on clean air so kids can stay healthy and in class?
Yeah, no, it's a great question. And so we invested over $100 million last year. And so we're going to continue to make investments. We have a system. You can go on our website and you can actually go by school, by classroom. And we actually analyze that data regularly, continuously, to make sure that if we see any schools, so if we see them in the green, that means they're fine. If we see them in the red, we don't allow children in those classrooms. So we've been monitoring classrooms all along. We will continue to make investments. We do have old buildings. And that is something that again, will always be a priority for us.
All right, great. And I do just want to say, there's a dashboard, I believe, that's still operational.
On the CPS website.
You can look literally at the classroom level, and they brought in industrial hygienists, the experts who, not just we looked at this school, but really classroom by classroom to make sure that that they are meeting and exceeding any standards around filtration. And that actually is, we get calls at the health department, we all talk about our school systems. People are really interested in that because that was an unusually high level of investment. And I think it's good. I mean, investing in the physical infrastructure of schools around COVID is good for other non-COVID things as well. But I think, if your child has been sick a lot recently, I would also think about, we're seeing a lot of that where there, more out of school type activities and gatherings and stuff too. And I know that can be hard when kids haven't had, I don't know if it was COVID or not, but there's a lot more colds going around. There's a lot more, all of the other,
a lot more gatherings outside of school.
A lot of other folks. And that's why having good access to testing is important because it helps it's not COVID. But, all of you with children probably have been seeing your kids get more of those, routine childhood viral illnesses. And so keeping with the hand washing, if you want to do some masking to get out of that cycle, all of that also helps with the other viruses.
Yes.
All right. And actually, so she followed up here, can you talk about some mitigations in addition to vaccines? Better air filtration in schools is a long-term investment in health and attendance. Is CPS continuing to work on this?
Yeah, absolutely. So we're going to continue to monitor the filtration in our schools, as Dr. Awadi said. On our website, you can go classroom by classroom. We're going to continue to monitor that. We're still making more investments in just replacing these old heating and air conditioning systems. So you'll see that in our next capital plan. And of course, we're going to continue to encourage masking. So even though it's mask optional, as I travel to schools every week, the vast majority of our schools I see masking, the vast majority. And so again, we just want to make sure we respect the choices parents are making. But again, on the margin, I'm seeing more children wearing masking than not.
So, and I see your note here that you're not gathering outside of school. So, okay, good. And I think that is probably one of the more important things. We're seeing a lot of other viral illnesses. We just are.
My own children just, recently got mild colds, but it was from, frankly, family events and gatherings, rather than the school.
Yeah, but working on air filtration is absolutely a continued commitment. All right. So I see Jason Guthards on Facebook has some opinions here. He notes that cases in Chicago are up. We're at 284 cases per day. If 200 cases a day was once a threshold, what has changed except for diminishing vaccine protection against a more contagious Omicron variant? And he's noting that a year ago that we were talking about, potentially we would consider reinstituting a mask mandate if we were recording more than 200 cases per day. So this is a couple of things. One is that we are in such a different place than we were because of vaccines. And we are seeing cases. Again, hear what I said about Europe and Australia and a lot of these other places that are seeing crazy high numbers of cases, but they are presenting like mild illness. They're not seeing big surges in long COVID. They're not seeing big surges in hospitalization. They really have seen this turn into something that, quote unquote, you can live with more. We cannot have a virus that is putting, dozens, hundreds of Chicagoans in the hospital every day. Like, that is not tolerable. We cannot have something that is creating lots of long-term disability, for folks here. But when we have learned how to have places open and the city open, frankly, we can do that. So we would consider, we get into trouble, we'll have a mask recommendation and then probably followed by a mask mandate. But that would not be at the 200 case level like we saw previously. Testing is extraordinarily different. We are testing, on average 4 to 5 times the number of tests that we were doing in July. So by that counter, you'd have to be at 1,000. If you say you're doing 5 times as much, even right now when testing is relatively low, we're doing 3 to 4 times as much. So 200 cases at 6,000 tests, per day is the same basically as 600 versus, this. And so with positivities where they are, testing where it is, that case count does not mean the same thing. And so that's where we look at all these metrics together. And again, we are in line with CDC. We are in line with WHO on every one of these metrics. We are low risk by every single thing that you look at. And that's a good thing. All right, we are out of time, but if we did not get to your question, we're actually not on next week. I am hopefully taking a little bit of a break for a week there, although I'll be working, but we won't be doing Facebook Live. Dr. Shaw on Twitter has a question about wastewater surveillance data. Our wastewater surveillance data is publicly available in the CDC's site. So please go to our website and take a look. Right up at the top from the data dashboard, if you pull down to wastewater, you can see the reports, you can see what's happening, but we filter it along with the rest of Illinois data up into there. So I'd encourage you to take a look at that. We will be back the week after next. And in the meantime, I want to wish, students a happy spring break. I'm
right.
glad from a travel perspective the country is doing how it is doing.
Mm-hmm.
But please be careful. Traveling, can be an increased risk just because people are out of routines. Anything you want to end with?
No, just, I just want to wish both our families and our staff just a restful week next week, and hopefully they'll be ready and excited to come the week after. We're getting into the last marking period of the school year, and I'm seeing more energy in our schools. The weather's getting nicer, so again, hopefully enjoy yourself and rest.
Good point to end. We'll see you not next week, but the week after next. In the meantime, be well, keep following the data. We continue to update it every day. Thank you.